You're reaching for that top shelf, perhaps just bending to tie your shoe, or maybe even enjoying a leisurely walk up a familiar flight of stairs when suddenly a sharp, unfamiliar twinge shoots through your knee, your hip, or your lower back. It's not just a fleeting ache, it's a distinct, unwelcome sensation that makes you pause, reconsider the movement, and maybe even wince. This isn't the kind of soreness you get after a tough workout. This feels different, more insidious, and somehow more permanent. It's a moment that many of us over the age of 40 recognize all too well, a stark, physical reminder that things are changing. This experience begs a crucial question: why does joint pain seem to become an unwelcome companion for so many of us after the age of 40? For years, you might have taken your joints for granted, moving freely, running, jumping, and lifting without a second thought. Then, almost overnight, your body starts sending signals you never anticipated. Perhaps you've dismissed it with a sigh, muttering, "Oh, it's just old age." Or perhaps you've heard the defeatist refrain that nothing really can be done. These are common assumptions. Yet they often miss the mark, oversimplifying a complex biological process. The truth is, while aging is a factor, it's far from the whole story. The discomfort, stiffness, and outright pain that many experience aren't simply an inevitable sentence handed down by time. There's a deeper science at play, a fascinating interplay of biology, lifestyle, and environmental factors that contribute to this widespread phenomenon. This isn't just about wear and tear, it's about intricate cellular changes, inflammatory responses, and shifts in your body's internal environment. We're going to dive into the true scientific and physiological reasons behind why your joints might be protesting more loudly these days, offering insights that go far beyond superficial explanations. On-screen text, joint pain after 40. Over the course of this exploration, you'll learn about the subtle yet significant biological shifts that begin to occur in your body as you cross the threshold into your 40s and beyond. We'll uncover how these changes directly impact the health and function of your cartilage, ligaments, tendons, and even the fluid that lubricates your joints. More importantly, we'll move beyond simply understanding the problem and delve into practical, evidence-based solutions that can genuinely make a difference. If you've felt that frustration, the limitation in activities you once loved, or even the fear that your active years are behind you, know that you are not alone. Millions experience this, and it's a valid concern. The good news is that the solutions are often simpler and more accessible than you might imagine. They don't always involve drastic measures, but they do require a fundamental understanding of what's truly happening within your body. We'll peel back the layers to reveal the silent culprits, those hidden factors contributing to joint degradation and increased pain sensitivity as we age. It's not just one thing, it's a symphony of changes, from cellular senescence to chronic inflammation, and even shifts in your hormonal landscape. Understanding these elements is the first crucial step towards reclaiming comfort and mobility. So let's begin our journey into unraveling the mystery of joint pain after 40 and discover what truly helps. To truly grasp why our joints begin to falter, we need to look back, not just at our personal history, but at our evolutionary one. Human joints are marvels of biological engineering, honed over millions of years for mobility and resilience. Our ancestors were constantly on the move, hunting, gathering, building, and migrating. Their survival depended on joints that could withstand immense physical demands, providing stability and flexibility across varied terrains and activities. These joints were designed for dynamic, active lives, not for the extended periods of sitting that characterize much of modern existence, nor for the highly processed diets that dominate our plates. This mismatch between our evolutionary blueprint and our contemporary lifestyle is a foundational piece of the puzzle. When we talk about joint pain, the phrase wear and tear often comes up, suggesting a simple mechanical breakdown, like an old machine. While there's an element of mechanical stress involved, this simplistic view is a myth that often misleads us. Our bodies are not static machines. They are dynamic, self-repairing biological systems. The reality is far more complex than just friction. Our joints are living tissues, constantly undergoing repair and regeneration. The issue isn't merely wear, but a breakdown in the body's ability to repair that wear, a process deeply intertwined with cellular aging. As we age, our cells, including those in our cartilage and the synovial membrane that produces joint lubricating fluid, undergo a process called cellular senescence. These senescent cells, often termed zombie cells, stop dividing but don't die. Instead, they accumulate and release inflammatory molecules, creating a toxic microenvironment that impairs the function of healthy cells. This means that the very cells responsible for maintaining and repairing our joints become less efficient and sometimes even detrimental to joint health. Cartilage regeneration slows, and the quality and quantity of synovial fluid diminish, leading to stiffer, less lubricated joints more prone to damage. On-screen text, inflammation. Perhaps the most significant, yet often overlooked, driver of joint pain post-40 is chronic low-grade inflammation. This isn't the acute inflammation you get from an injury, but a persistent, systemic smoldering that silently erodes joint health. Inflammatory pathways triggered by various factors like diet, stress, environmental toxins, and even lack of sleep begin to run rampant. These inflammatory molecules actively contribute to the breakdown of cartilage and sensitize nerve endings within the joint, making us more susceptible to pain. Imagine a constant low-level fire within your body, slowly but surely damaging the structural integrity of your joints. Our modern diets, rich in processed foods, sugar, and unhealthy fats, are notorious for fueling this inflammatory fire, while chronic stress keeps the body in a perpetual state of alert, further exacerbating these pathways. Beyond inflammation, hormonal shifts play a crucial role. For women, the decline in estrogen levels during perimenopause and menopause can significantly impact joint tissue elasticity, bone density, and inflammatory responses. Estrogen has protective effects on cartilage and bone, and its reduction leaves joints more vulnerable. Similarly, a decline in testosterone in men can also affect muscle mass, bone density, and overall tissue repair, indirectly impacting joint support and health. Another critical factor is sarcopenia, the age-related loss of muscle mass and strength as we lose muscle. Especially around major joints like the knees and hips, these joints lose their natural shock absorbers and stabilizers. This places increased stress directly on the cartilage and ligaments, accelerating their degeneration and increasing the risk of injury and pain. Imagine a building whose foundational supports are slowly weakening. The entire structure becomes more vulnerable. Furthermore, the very fabric of our connective tissues changes. Collagen and elastin, the proteins that give ligaments and tendons their strength and flexibility, become less elastic and more brittle with age. This reduces the overall flexibility of our joints and increases the risk of sprains, strains, and tears. Simple movements that were once effortless become challenging, and the body's ability to bounce back from minor stresses diminishes. And here's an interesting fact you might not expect. Emerging research is drawing fascinating links between our gut health and joint pain. Our gut microbiome, the complex community of microorganisms living in our intestines, plays a profound role in regulating our immune system and systemic inflammation. An imbalanced microbiome, often referred to as dysbiosis, can contribute to chronic inflammation throughout the body, including in our joints. This suggests that the health of our gut could be intimately connected to the comfort of our knees, hips, and shoulders. Understanding these intricate biological shifts is the foundation upon which we can build effective strategies for joint health. Understanding these intricate biological shifts is the foundation upon which we can build effective strategies for joint health. Now, let's move beyond simply identifying the problems and explore tangible solutions. It's time to shift our focus from merely managing symptoms with painkillers to adopting a holistic approach that addresses the root causes of joint pain after 40. This isn't about quick fixes, it's about sustainable, evidence-based practices that truly make a difference. Perhaps the most potent medicine for our joints is movement itself. While it might seem counterintuitive to move a painful joint, targeted exercise is critical. Low-impact activities like swimming and cycling are excellent because they provide cardiovascular benefits and strengthen muscles without putting excessive strain on joints. The buoyancy of water in swimming, for instance, reduces gravitational stress, allowing for a greater range of motion. Equally important is strength training. As we've discussed, sarcopenia contributes significantly to joint vulnerability. Building and maintaining muscle mass, especially around major joints, acts as a natural support system, reducing the load on cartilage and ligaments. Think of strong quadriceps protecting your knees, or robust shoulder muscles stabilizing your rotator cuff. Furthermore, flexibility and balance exercises such as yoga or tai chi are invaluable for improving range of motion, enhancing joint stability, and preventing falls, which can lead to severe joint injuries. Remember, motion is lotion for your joints. It encourages the production and circulation of synovial fluid, which lubricates and nourishes cartilage. What we put into our bodies also profoundly impacts our joint health. Nutrition plays a pivotal role in either fueling or fighting inflammation. An anti-inflammatory diet rich in omega-3 fatty acids found in fatty fish, flax seeds, and walnuts can significantly reduce systemic inflammation. Antioxidant-rich fruits and vegetables like berries, leafy greens, and colorful peppers combat oxidative stress that damages joint tissues. Conversely, limiting processed foods, added sugars, and unhealthy trans fats is crucial, as these are notorious for promoting inflammation. And don't underestimate the power of hydration. Water is a key component of synovial fluid, keeping our joints well lubricated and functioning smoothly. Beyond diet and exercise, the often overlooked pillars of health, sleep and stress management, are vital for joint well-being. Poor sleep quality exacerbates inflammation and heightens our perception of pain, creating a vicious cycle. Prioritizing 7 to 9 hours of restorative sleep allows the body to repair and regenerate. Similarly, chronic stress keeps our bodies in a state of heightened alert, releasing hormones that can contribute to systemic inflammation and muscle tension, further aggravating joint discomfort. Practicing mindfulness, meditation, or spending time in nature can significantly mitigate these effects. When it comes to supplementation, popular options like glucosamine, chondroitin, and turmeric have shown promise for some individuals. Glucosamine and chondroitin are natural components of cartilage, and supplements may help with cartilage repair and joint lubrication. Turmeric, with its active compound curcumin, is a powerful natural anti-inflammatory. However, it's crucial to approach supplements with caution and always consult a healthcare professional. They can provide personalized advice based on your specific health needs, potential interactions with medications, and the quality of different products. Ultimately, navigating joint health after 40 requires a proactive and informed approach. The value of consulting doctors, physical therapists, and registered dietitians can't be overstated. They can offer accurate diagnoses, tailored treatment plans, and guide you through safe and effective exercise routines. It's time to reframe the narrative around aging. Getting older doesn't have to mean an inevitable decline into chronic pain. Instead, view this stage of life as an opportunity to proactively invest in your physical well-being, enhancing your quality of life for years to come. Armed with this knowledge, what one small, actionable change will you commit to this week to support your joint health? Perhaps it's incorporating a 15-minute walk, choosing an anti-inflammatory meal, or dedicating time for mindful relaxation. Share your experiences and strategies in the comments below. Your insights could inspire someone else on their journey. Let's foster a community where we question common health myths, seek evidence-based information, and take control of our health. Your joints have carried you this far. Now it's your turn to carry them forward with strength, mobility, and comfort.